The CDC recently released a report showing that vaccine rates for kindergartners continue to fall. This says the proportion of children exempted from vaccinations is at an all-time high. Joining us now is Will Humble, Executive Director of the Arizona Public Health Association. Will, good to see you. Thanks for joining us.
My pleasure.
All right, CDC says are you surprised that these rates are falling?
No, this is the trend that's been happening for the last 15 years. I mean, in Arizona, we've lost about 0.5% every year for the last 12 years. And the new report that just came out, same thing. We lost 0.5%. So we're down to 88.6% for the MMR vaccine, which is the one we look at first because it's the most contagious childhood illness, and you have to have really high vaccination rates to keep that from spreading.
So why is this happening? Why has it happened? Why does it continue to happen?
So this is in the category of a long-term problem. This isn't something that just started happening in the last 2 or 3 years, or even after the pandemic. I mean, it's gotten a little worse after the pandemic. But it started with parent groups questioning vaccines on Facebook and sharing things on social media, and it started gathering more and more momentum. And I think that trend continues and has been just pretty insidious. And there's another thing, which is the generation of people who experienced these diseases real time are fading away. And the parents of today were born, in 1990 when there were measles. What's that? So, that scared factor that my mom's generation had is not present with this new generation. And they see, well, there's no illnesses around. Why should I get the vaccine? But the reason there's no illnesses is because we've been vaccinating for decades.
Did COVID make a difference here? But this started before COVID, right?
Yes. That's like I said. It's gotten a little bit worse, but this was happening back when I was the state health director 10 years ago. We were losing 0.5% a year. And so there's something, it's not just the pandemic. There's a longer term issue that's happening. And by the way, it's not access. It's not like people aren't able to get the vaccine.
Well, and that's what I'm going to ask here. Exemptions, they're at an all-time high. I know they play a factor all around the country. How much of a factor do they play in Arizona?
Well, it's a huge factor, and I think that's a big reason why we're 40th out of 51. They count DC as a state. So we're near the bottom, and one of the reasons is because in Arizona we have a personal exemption, so that when your kid shows up at kindergarten and they're unvaccinated, the admin person said, well, just sign this exemption form and we'll just get your kid enrolled. That's not the case in every state. So, for example, in Mississippi, Mississippi seldom has better public health outcomes than other states, but they're with Connecticut tied for the best vaccination rates. Why? Because they have a law in place that says they only have medical exemptions. So you can't just sign a form and say, I don't want to vaccinate my kid to go to public school, or school generally, even private schools. So the states that have a school requirement are at the top of the list, doing the best, and the states that don't are at the bottom, and we're one of those.
And Mississippi is number. I find that difficult.
How often do you see Mississippi and Connecticut
as number one for health? But what was also interesting, Minnesota,
right?
Not good.
Right. Minnesota is even worse than Arizona, and Minnesota they invest a lot more in public health than we do here in Arizona, and yet they're worse than us. And it's not access to vaccines. It's because, in part, they don't have a school requirement.
So what does this mean as far as the percentage that's needed for herd immunity? Where are we? Let's stick to Arizona on this.
So it depends on what part of Arizona you're talking about.
Interesting.
So if you're talking about like Nogales and Santa Cruz County, good to go. They're above 95% for the MMR vaccine. Measles is the most contagious one. That's why we track that the most. Pima County is doing good. Tucson has pretty good vaccination rates. If you look at Yavapai County and Mojave County, they're way below. They're like at the 70% level, similar to what in Texas, the huge outbreak, 1,300 people infected now in Texas. Those two counties have rates similar to that part of West Texas. So that's just a flame ready to ignite.
And what number again are we looking for herd immunity?
95%.
95?
Right.
And we're seeing 70 in Yavapai?
Some of those counties. But like I said, other parts of the state are doing really well. Maricopa's sort of in the middle.
Right, right. Probably pockets in Maricopa County, just like in other areas.
Right. And I don't know how long this segment
Go
is.
ahead, just keep going, keep
But
going.
there's also a thing where you see public school kids have pretty good vaccination rates. Charter school kids and the private school kids have much lower vaccination rates.
Wow.
So that's like within the same geographic area.
I get it. How is the data collected, and is the collection process the same with this administration? Because we know that if you have a bad jobs report, you're out of here. If you have a bad, I don't know, do you want a bad immunization report? I don't even know what's good anymore as far as health and this administration.
Yeah. So the way nothing's changed. So the answer to that
Okay,
question
okay.
is nothing has changed. States report that data to CDC, and then they compile it. Usually CDC will put out a big, what's called morbidity mortality weekly report, and like summarize the data and do a write-up and do an analysis. Like,
Okay.
they didn't do that this time. They put up a spreadsheet, which I found.
Yeah.
I wrote my blog post, but they're not advertising vaccines these days. But,
All right.
I don't think they're cooking the books.
Okay, good to hear. I don't know if it's good to hear or not, whether the job is safe or not, if it's a low or high vaccination rate. With that in mind, the CDC also has a new director. What do we know about this new director?
Yeah, so I personally didn't know her, but I called some of my contacts from the public health world, and her name's Susan Monarose, and she took a lot of heat in her confirmation hearing from some people because she's not an MD, she's a PhD. I don't care about that. I was more interested in learning about her commitment to evidence-based decision making and evidence-based public health like policy, and there she seems like she's in pretty good shape. In other words, she's a longtime public health person who's well respected. Now, I can't say today whether she'll be a good CDC director, but the ingredients are there, I think, for her to be as good, I think, as I would have ever been able to expect from Mr. Kennedy.
With that in mind, is her only positive that she's not a negative?
Well, no, I mean, she actually has an academic credentials.
All right.
And
well, when you say it's more than you expected from...
Well, I just expected, maybe it could have been somebody who really didn't care about public health at all. She's got all the credentials are there, but you have to give some time to see whether she makes good decisions or not.
Yeah, there's some optimism there.
Yes.
All right, Will Hummel, Arizona Public Health Association, former state health director, and a friend of the show. Good to see you again.
Thanks. Take care.